Hi and welcome to the Item System webinar training session for DMP assessors who are associated with the Allied Health Professionals Prescribing Training Program. I'm Libby Shepherd and today I'm going to talk to you about the item system, and by the end of the session you're going to understand how you can access the system and troubleshoot login issues, understand how to use your dashboard, including how to view and amend your profile, view messages and access your students' portfolio. We'll also look at how to carry out a formal assessment, both the over-the-shoulder process and via remote access function. And finally, we'll look at how to use the help guide. Before we look at the actual system, I wanted to talk about access to the system and the support available. Due to the age of Internet Explorers in Queensland health organisations, the best way to access the system for its optimal viewing is through Mozilla Firefox browser. And this can be done at home as well. It's a free download. It will be compatible with very up-to-date browsers, but we would recommend that Mozilla is used as the primary browser wherever possible. To access the system, you've been sent a username and password. Your username is your email address, which was given to us through QUT, and your password you change to a password that is preferable to you at your first login, and you will need to change your password every 3 months. We'll go through login issues when we go through the system. Access through the system is through a secure server at system.itemsforhealth.com.au. So in terms of training, you will all receive access to one webinar training session, which is this one. There are more available on request, but we believe this would be enough for you together with the online help guide to get you through the system. The online help guide has written help as well as a video walkthrough, so everything we're going to talk about today will also be in the help guide, so you can refer to it any time. We have a live chat system that's available through the website, so you just click on the help icon at the bottom of each page. This is available between 8 AM and 8 PM, Monday to Friday. If for any reason you need to contact us outside these hours, you can leave a message with your contact details and we'll be in touch with you. You may be aware that this version of the item system is just new to the market, so inevitably there probably will be some errors or bugs throughout the system, which just occurs as it is a software system. So if you want to report any of those, you can report it through the help guide by just typing in error in the search box, and that will take you to our live chat and you can give us the information about the errors occurring on the page. Alternatively, you can contact us via email at support@itemsforhealth.com.au, and that email is on the email you received with your username and password, so if you keep that, you'll always have access to the email. We will be updating the system throughout the time you're having it, so we'll inform you via the message board on the system and via email when this happens, so you're completely aware of what's happening. Once you've accessed the system at system.itemsforhealth.com.au, you simply enter in your username and password. So your username is your email address and your password is your temporary password, which has been emailed to you, and on the first login you'll be asked to create a new password. Now if you forget your password at any time, you can reset your password by clicking on the Forgot Your Password link. You'll then enter your email address and a new password will be sent to you. One thing to remember is that if you fail to log in successfully 3 times, your account will be locked for 20 minutes and you can try again, or simply just reset your password just by clicking on the Forgot Your Password link. The dashboard is the home page for the system, and here we'll look at how you can access your profile, change your username and reset your password. We'll also look at the messages quadrant and how you can view sent messages, and also at the manage request page, which allows you to remote access your students' profiles. Once you've accessed the system at system.itemsforhealth.com.au, you simply enter in your username and password. So your username is your email address and your password is your temporary password, which has been emailed to you, and on the first login you'll be asked to create a new password. Now if you forget your password at any time, you can reset your password by clicking on the Forgot Your Password link. You'll then enter your email address and a new password will be sent to you. One thing to remember is that if you fail to log in successfully 3 times, your account will be locked for 20 minutes and you can try again, or simply just reset your password by clicking on the Forgot Your Password link. The first page you'll see is your dashboard. Your dashboard is the home page within the application. and it allows you to view and change your profile, view messages, and access your student's portfolio. To view your profile, simply click on the My Profile link, and you can see here this will list your full name and your email address. If for any reason you want to change your email address to a personal email instead of your work email, for example, you can change it here and save it, but please remember that if you do that, your username will change to the email address recorded on this page. You can change your password by any time by clicking on the Change Password link. The Messages quadrant allows you to view messages sent to you by the module coordinators. If any messages are put here, you'll also be notified by your email address so you know when to access the system. To view your user's portfolio, click on the Manage Requests button, and any students that are assigned to you will appear here. In order to remote access their portfolio, just click on the Remote Access button. When we go through the formal assessment process, we will talk about how to carry out the formal assessments. So you can see here that you're viewing your student's portfolio, and you can notice that the navigation bar is now pink, which signifies that you're viewing their portfolio. We'll go through how to complete a formal assessment when we talk about this in the next module. As a DMP assessor, you'll be asked to carry out a number of formal assessments against each of the competencies assigned to the students. Now you can do this in two ways. You can do this as a bedside assessment. This means that in a clinical area such as a ward or outpatient clinic, it may be difficult to put the assessment directly onto the item system. Therefore, we have provided some hard copy templates that can be downloaded and will be given to you by the student, and you can use these to actually assess the student in real time. You can then transfer that information directly onto the system, either immediately after the episode or at a later date. Or you can just directly enter the data into the system for each of the formal assessments. Now you can do this in two ways as a DMP assessor. You can use the over-the-shoulder process. So this means that you and the student sit down side by side. The student will log into the item system and you will carry out a formal assessment, either entering in the information that you recorded in the hard copy template or just directly into the system. Alternatively, you can do this without the student being present by logging into the system yourself and using the remote access function. So in this training session, I'm going to show you how to do both of those assessment processes. So the example here of the bedside assessment is a hard copy template of competency KC1. Now this will be downloaded from the system and given to you in hard copy format by the student. It mirrors what can be seen within the system, so you can see what each of the levels of competency means, whether 1, 2 or 3. It details the performance criteria and also gives you additional information under each criteria which will assist you in assessing the student. So when you complete this form, you can add comments for each of the criteria, you can add overall comments, but please ensure that you put your name and your signature and the date of the assessment on this form, as this will be used as evidence within the system. And as I mentioned before, optimally we would like you and the student to put this into the system so the student will have all the information they need in terms of their progress within the system, and it will help them identify where their learning needs are and also help them define realistic timeframes to actually achieve the scores required in a summative assessment. So to use the over-the-shoulder process, you sit down with your student, they enter in their username and password, and you access the system together. So you'll see here you're in your student's profile and you're looking at their dashboard, and to access the competencies module, you click on competencies in the modules menu or click on the Go to Competencies button. So on this page you have two tabs. We have a competencies tab which shows the active latest assessments carried out, and then you have a history page which we'll look at in a moment, which shows all the assessments carried out over the whole training program. So just a brief outline of the page. We have the prescribing group, we have the competency code, and in this example it's KC1 and it sits within the information gathering category. We have the name of the competency, we have the latest score, the date of the last assessment, and we have the type of assessment. So this example is a self-assessment, The students can carry out self-assessments, and if they do so, you'll be able to compare their scores with your scores during the formal assessment process. However, this is not a requirement for them. So therefore, we'll move straight to the Start a Formal Assessment link. So this is what you need to do when you're entering in data from the hard copy template that you use in the Bedside Assessment, or if you're directly entering the information for the assessment into the system. For this example, I'm actually going to carry out a formal assessment on KC2. So to start a formal assessment, we click on the Start a Formal Assessment link, and you enter in your own username and password for the item system, which has been sent to you by email. Press continue, and it takes you to the assessment page. Now on the assessment page, you can see that you're completing an assessment for KC2 and the name of the competency, and then you see a progress bar. So the first page is the assessment page. There is an evidence page, so the student can upload evidence to support their assessment. However, this is not a requirement during this training program, so we'll be moving straight to the overview page, which just shows you an overview of what you scored and allows you to leave comments for the assessment. So we can look at the assessment page now, and you can see here there's a link that allows you to view the competency scale description. So for this training program, we have 3 levels of competence. We have level 1, which is less than competent, 2, which is competent, which is where the students are aiming to be by the end of the training program, and 3 is that they're very competent. So this means they're an expert or an advanced practice practitioner and allows them to teach others. And then we have an NA option. Now the NA option can be used for a variety of reasons. It may be that the criteria itself wasn't relevant to the case, or that the student didn't demonstrate the criteria and you need to comment that if it was essential or not essential to the case. So every time you click NA and any of the criteria, you need to leave a comment. Please note that you need to score 50% or more of the criteria with the scores of 1, 2 and 3 in order to achieve a valid assessment. Another way we can see the scale descriptors is just hovering over the scale itself. So on this page we can see a number of criteria that the student needs to demonstrate in order to actually be competent in this competency. Now the More Info button has some more information to assist you whilst assessing the patient, so you can determine what level they've achieved for each of the criteria. To score the student, you just simply click on the relevant box for each of the criteria. If you make a mistake, you can change it quite easily. If for any reason you weren't able to finish this assessment, you can save it for later by clicking on the Save for Later button on the bottom left-hand side. And this will show your assessment as an in-progress assessment, so you can go directly back to this assessment. However, if you have completed the assessment, you can just click on Review and Finalise Assessment. This then takes you to the overview page. So on this page, for each of the criteria, you can add a note, remembering that anytime you score a person with the NA option, you need to put comments into why you have done that. So you can add notes in here and you can save them for each of the criteria. This gives you the overall score for the student, and then you can add some notes in about the assessment itself, which will appear in the overview page and allows the student to actually refer back to this and help them progress more quickly during their assessment as they can identify their needs. On completion of the assessment, you need to click on Finalise Assessment in order to sign it off. And you can see a message came up to confirm that it has been finalised. And then you can click Back to Competencies and you can carry out another assessment. The evidence column on the far right hand side is actually where you find the hard copy templates which we're talking about with the Bedside Assessment. So if for any reason the student was unable to give this to you, you can actually download them from here. And if we click on the link, you can see we have the template which you can print off. So at any time you can review these assessments by clicking on the history page, and you can see here the latest assessment carried out was a formal assessment by this DMP assessor the score was a level 1 and it's been finalised. So both you and the student can review the information and any notes made by clicking on show notes or hide notes or the individual notes under each one. And if there is any discrepancy and you have made a mistake or want to make any amendments to the actual assessment, you can click on the Edit Assessment button, which just asks you again to put in your username and password to ensure that the person changing is the correct person. And this will take you back to the assessment. You can make the necessary changes, click on Review and Finalise, and save the assessment again. Now I'll just show you what happens if you have started an assessment and either you haven't completed it or the student's not with you want to talk to them about it prior to finalising it. So if we click on Formal Assessment again, and carry out another assessment, ensuring that you leave some notes if you have marked any criteria as NA. You can save this for later. So we click Save for Later, go back to the Competencies tab, and you can see, although there is a score, it's in progress. So it's saying here that the assessment has been complete, however it hasn't been signed off. So to go back to this assessment, you click on the In Progress link. Again, enter in your username and password, remembering you're probably doing this at different times of the day rather than straight after each other. So you can see it takes you back to the assessment. You can make any changes if you need to, and then click on the Review and Finalise button, which will allow you to sign off the assessment. And then you just scroll down and click the Finalise Assessment button. And if we go back to Competencies tab, we can see that it has been signed off. And again, if we look at the History tab, we can see that which assessor has carried it out and it has been finalised. So that's how you carry out a direct entry over-the-shoulder assessment. Now I'm going to show you how you can log into the item system with your own username and password in order to carry out an assessment without the student being present using the remote access function. So you just enter in your username and your password. So to carry out an assessment using your own login, you go to the Manage Request button, and on this page the students assigned to you will appear here. In order to remote access them, you just click on the Remote Access link, and you can see here there's a slightly different view where we have the name of your student, so you're viewing their portfolio, and also the colour of the navigation bar has changed. What it means is you're actually viewing your student's dashboard. The whole assessment process that we just went through is exactly the same in the remote access function. So we'll just go through one as an example. Just click the Go to Competencies button. You can see here the assessments we just carried out are already here. The only difference in the remote access function is that you don't see the Start Self-Assessment link. So because you're carrying it out, you don't need to log in to carry out the assessment during the assessment process, and we just click on the Start Formal Assessment link in order to take us to that assessment page. It works in exactly the same way as the over-the-shoulder assessment, and on completion of the assessment you click on Review and Finalise to sign off the assessment. And then you can just finalise the assessment and go back to competencies, and you can just stay on this page for as long as you like. The remote access function is very helpful if you've done a lot of bedside assessments, which means that you've got the hard copies in front of you and you can sit down at a time that is suitable for you, and you can enter in the assessments to ensure that the student has everything they need within their own system. To stop the remote access, you just click Stop Remote Access, and then you can just log off yourself. The final module in this training session is the Help Guide. We will look at how to access the online Help Guide, including step-by-step instructions and the video tutorials, how to use the live chat system, and how to submit errors or bugs within the system. The Help Guide can be accessed in two ways, either by clicking the Help icon at the bottom right-hand corner of each page, or by clicking Help in the navigation bar. This will open up a new window, and when you find what you're looking for, you click on the link, which will give you a link to the video or the step-by-step instructions on how to complete the assessment. You can use our live chat between 8 AM and 8 PM Monday to Friday by just entering in your message here, and one of our team will be in touch with you very soon after. After hours, you can submit a request by clicking on the link. And you can just leave your email address, the subject, and the description of your inquiry. Alternatively, you can click on the help icon, enter in what you're looking for. Here you'll find the top 3 articles that meet your search criteria, and you can just click on the link to watch the video or view the step-by-step instructions, or use the live chat as discussed before and enter in your query here. One thing to remember, if you do use the help icon, once you have finished your live chat, you will just need to refresh the page in order to start a new live chat in the future. When using the system, you may come across some bugs or errors within the system. You will normally come across a page such as this when this happens. So this just explains an error has occurred. And then in order to inform us what's happened, so we can fix it as quickly as possible, click the Copy to Clipboard button. This will open up a pop-up window, and you'll just click on the OK button. Go to the help guide on the system, type in error, which will take you to the live chat section, and simply paste in what was on the clipboard by clicking paste. And that will be sent to us, and we'll be able to identify where the bug is in the system very quickly and ensure that you'll be able to use the system again very soon. In summary, you should now know how to access the system successfully and manage your login details, including your username and password. You will know how to view your messages, access both the competencies and journal modules, know how to record your formal assessments with your DMP assessor, and also record your learning and practice hours in the journal, upload your case study assessments, and also use the help guide. Your DMP assessors will be emailed the training session times, which will be scheduled throughout the coming weeks. Thank you for attending this webinar training session. If you'd like to know more about the item system, you can go to our website, www.itemsforhealth.com.au, or you can contact us at support@itemsforhealth.com.au.